Hi, I'm Ellen Turner.
And I'm Ray Turner.
We're members of St. John Vianney Parish Catholic Church in Alum Rock.
When I retired from Cadence, we studied all the options available to us for health insurance. We decided to get group coverage through the International Engineering Society that I belong to. The cost was comparable to other options, and we thought it a safe bet since the society has over 300,000 members.
The original policy had a per family $2,000 deductible, which is pretty high, but we're basically healthy, so it seemed okay. After 1 year, they raised the premiums, and shortly after that, they raised the deductible to $10,000 per family. So we got nothing for what we paid. 6 months later, the cost was raised again, and finally, in December of 2008, our cost, which originally was $30 a day, went to $71 a day over a 3-year period. For most of us, insurance is a gamble. We're betting that we might get really sick, and unfortunately, since the insurance companies have all the statistics, we're betting against the house. And you all know how that goes. The house always wins.
With the final increase last December, we realized we simply couldn't afford to keep buying this health insurance. At $71 a day, that's over $25,000 a year. It was costing 25% of our retirement income just for health insurance that didn't pay any of our health care costs. For a time, we faced the frightening decision of dropping health insurance entirely. But then we tried applying for health insurance from Aetna. When you get your health insurance through your company, the insurance company can't turn you down. When you're outside a company group plan, they can turn you down for any number of reasons or for no reason at all. Aetna did turn us down, citing unspecified pre-existing conditions and a body mass index, a BMI, outside their norms. This was the first I'd heard of a BMI. It's just another reason insurance companies can use to deny coverage to people or to cancel coverage later. It turns out most Americans have a BMI which is too high, rendering most of us uninsurable on our own. At this point, I began to feel pretty hopeless.
Rather depressed in December, I finally contacted the state agency that's responsible for controlling insurance companies to see if they could help me. They could do nothing about the company I was working with, but did tell me about a special program that forces insurance companies in California to take people in our position who cannot get coverage due to pre-existing conditions or who cannot afford the premiums. We now have Kaiser coverage through the state MRMIP program and should be okay until Medicare kicks in for us in 3 more years. We now pay $42 a day, over $1,200 a month, which is still pretty high, but it was the cheapest we could find. And the deductible is only $500 instead of $10,000, so we are actually getting something for our money.
The prospect of being without health insurance was frightening. If one of us was to get really sick, we could lose all of our retirement savings and even our house. Some people have. I think we made good choices based on what we knew at the time. We were still caught up in a system that delivers hopelessness instead of health care. We anxiously await being eligible for Medicare at 65, and we have the audacity to hope that our government will do something for all of us sooner than that. Thank you.
Thank you.